Welcome to this special edition of the TDI Sustainability podcast series, Suits and Boots, brought to you as part of TDI's strategic partnership with the Mining Indaba 2025. The Mining Indaba, as many of us know, is a premier gathering of the mining and metals industry from the mine to the manufacturer. I'm Ashton Carter, CEO at TDI Sustainability, and I'm joined today by 4 representatives from different parts of the mining industry who will be speaking at this year's Mining Indaba event in Cape Town. Over the course of this series of special edition podcasts, we'll be discussing the key themes of this year's Indaba event. Today's topic is prioritising health and safety, and we'll be talking about whether zero harm is a reality, some of the hidden costs of safety neglect, and how the needs of African mining communities are being and can be prioritised. I'm delighted to be joined today by Dr. Thuthula Balfour, who is the head of health and the lead on women in mining at Minerals Council South Africa. The Minerals Council South Africa is a mining industry's employers organisation that supports and promotes the South African mining industry. Thuthula is a qualified medical doctor and public health and medicine specialist with an MBA and a diploma in occupational health. In 2018, she was named as one of the top 100 global inspirational women in mining. I'm also joined by Georgette Barnes, Sakyi-Addo, President of Women in Mining Ghana. Georgette is a Ghanaian mining executive with 30 years of experience in mining administration, business development, gender advocacy, and stakeholder management throughout Africa. Forbes named Georgette as one of the most influential female leaders in Africa in 2023. She has extensive experience in understanding of Africa's extractive sector, and she promotes women's diversity, inclusion, participation in governance and enterprise in the mining sector. Paule Ndessomin is a regional secretary in Sub-Saharan Africa of IndustriALL. IndustriALL Global Union is a global workers' federation representing more than 50 million workers across 150 countries globally, based in Geneva, Switzerland. I've worked with representatives of IndustriALL for the last 25 years and know it to be a very important organisation, and in no sector is it more important than in mining and minerals. Paule is feminist and a gender advocate who, she will tell you, is passionate above all about women's rights within the labour movement and more generally in sub-Saharan Africa. Finally, Penny Munkawa is a practicing occupational health and safety specialist at the International Labour Organization, the ILO. Her achievements include implementing gender-responsive safety policies, protecting vulnerable workers, securing safety rights in national laws, strengthening national safety and health systems, and promoting international labour standards. Thank you all for joining us today. So today we've picked up a few themes of occupational health and safety in mining that will be discussed at the Mining Indaba in February. And one of these, and where I'd like to begin, is targets, specifically zero harm targets. So targets have become a norm in corporate and political life. We're told we cannot manage anything without them. Some see targets as the instrument to enable change. Others see them as a curse inhibiting the innovation and creativity needed to effect meaningful and sustained impact. Is setting targets the best way to go when it comes to occupational health and safety? Is the zero harm target a reality? Is it realistic? Thuthula, can you explain a little bit about the origin of and what is meant by zero harm in the workplace and the progress so far from your point of view in meeting those targets in the industry? Where do you stand on the efficacy of targets in health and safety?
Greetings to my fellow panelists, and thank you very much for being invited to be part of this panel. The zero harm, we have had zero harm for some time. And internationally, it originated in the manufacturing and construction sectors. Really, it's about the idea that safety and health, if I may add, is the absence of harm. And so it's a strategic approach to workplace health and safety, which aims to eliminate any risks and hazards that can harm people. There is always a lot of debate about, is this possible or not? And I would say the setting of targets makes this very possible. And we've got a case study in South Africa on how this has happened. I think we need to realize in the workplace, especially in my sector, which is mining, we actually have a lot of the production people are engineers. And for them, it's far easier to work with facts and figures and the notion of, measurement. You manage through measurement is key. And so they really work very well with targets. So if I can just tell you then about the South African case, Our zero harm journey started probably in 1994 with our democracy, when the Leon Commission was set up by President Mandela and made many recommendations on how we can improve our health and safety on the mines, which was at the time really very challenged. We then, as a tripartite, which is the Mine Health and Safety Council under the Department of Minerals, we set on a journey of setting targets. So for 20 years now, we've been setting targets, 10-year targets starting in 2003. And this has really worked well. These are stretch targets. And actually, whenever they are set, everyone is complaining, especially us employers, I have to say, because we say this is impossible. But sometimes we find that which we thought was impossible actually becomes possible. In 2003, we had about 270 people who die. That is the fatalities in the industry. And we then set a target that we need to reduce this by 20% every year, although we did not meet the target. And I think it's important to note that you sometimes don't meet the target, but it's what you do that makes you see results, such that by 2023, we were on 54. And we had the lowest number of deaths in 2022 with 49. And we are poised this year to report probably that for 2024, we were even lower than the 49. So what happens is these really drive performance, and people measure themselves. And we have seen similar efforts with our silica dust levels, which seemed impossible for us to reduce, the current statutory limit. And we made major progress. So we actually are almost achieving, as an industry, we're almost achieving the target that was set for silica dust, which was that we should get to 0.05 milligrams per cubic meter, which is the international target for most, jurisdictions. And lastly, I would say the TB rates, we made, again, great progress, and the 2024 target was met. So all I'm saying is, when you set targets, because these are measurable, then it makes, it stops the woolly, what should we be doing? And people can actually, on a year-to-year, month-to-month basis, work towards those targets, and it's very effective.
Thank you, Thuthula. It's very reassuring to hear that progress, and also to hear your optimism about the possibility of reaching zero harm. Georgette, we've heard that there's significant progress, but is there something that is specific about the mining industry that makes it particularly challenging to reach these targets? Can engineers more familiar with facts and numbers and flow charts also put their considerable talents and skills to addressing health and safety concerns? And I think I'm right in saying that the record for women and health and safety in mining operations is very good compared with males. Especially, I've seen the facts, the statistics on women drivers in mining, and it's very impressive. Is that right? And if so, why? And can we learn something from that?
Thank you, Assheton. Yes, health and safety, targets, achieving targets, enforcement seems sometimes to be an issue. But the very thing is, mining operations generally, by their nature, involve a lot of risk. From the very beginning, the act of displacing people from their lands itself, it sets us off on a trajectory of people mistrust. So we are starting, not talking about the workforce, but, even with the community around the mines and all of that. So there is a lot of other issues. When we speak about the health and safety, displacement is bringing a lot of issues. For example, when you speak about commercial agriculture or large-scale road constructions, for example, in my country, people are displaced, but usually communities tend to see immediate benefits through recruitment of, example, non-skilled labor and other informal economic opportunities. So as we are striving to achieve zero harm in the workforce, we need to also think about the communities as well. And the communities usually are lacking behind the health and safety issues. When we speak about the women's involvement and the role of women, yes, there have been several studies, and even here in Ghana, informally and even in some formal settings, it has been mentioned how the female haul truck drivers are more attentive. They report issues quicker, and in that case, preempt maintenance and repairs and save, a lot of issues otherwise that would have occurred. Even in Ghana as well, there is a company called Ladybird Logistics, where they have all-female truck drivers, and they are conveying and transporting fuel in these large tankers. And the company owners have also come out to say how safety conscious, and there is a difference in the woman's attitude to health and safety than, compared to the men. And so I think that from even a layman's perspective, I think the females tend to report issues quicker. They are more careful. Their attitude is not as prevalent as maybe the male. I don't have the scientific, backing for that. But yes, the females are doing much better. And the legacy of mining safety, health issues is historical. And so we need to work better. We need to work at it. The targets, as Thuthula had mentioned, is great. And regulatory frameworks are so important, but they have to be enforced. And those who are doing better, I believe, need to be continuously rewarded. It encourages other companies as well. Having said that, in my country, the health and safety zero harm, I must say, has not been transferred to the small-scale mining sector so much.
Thanks so much. And Paula, from your point of view, IndustriALL, of course, has a global view. How do you see the progress being made towards zero harm? And are there any hidden costs to safety or the neglect of health and safety at mines that we should bring to the attention of management to make the case for more attention given to this topic?
Thank you very much, Assheton. I like to start, for instance, from where Dr. Thuthula, started from, and then perhaps end it with Georgette's input. It's true that zero harm, setting target for zero harm is very important, because this is, how when you have all the statistical data and analysis before you to make any kind of assessment whether there have been progress or no progress. And then Dr. Thuthula just gave an example in the case of South Africa. I must say zero harm is actually, it's possible. For the case of South Africa, it's important because South Africa has a very solid legal framework when it comes to health and safety, especially because South Africa also has ratified the ILO Convention on Safety in Mines, Convention 176. It gives the opportunity, for instance, for South Africa to establish some of this robust legal framework and then compliance mechanism at the workplace. Also, one of the very important factor in the case of South Africa is the presence of strong unions. I mean, Dr. Thuthula mentioned the fact that when they started with these targets from the late 90s to or early 2023. Perhaps this early 2000s, late 90s, 2000s is where the National Union of Man Workers were really, at its highest. I mean, it was a very, very powerful union. And then you need a very, very powerful union, at the workplace to make sure that some of these standards are complied by the employers, for instance. In the absence of that, it's not really, it's going to be possible, but very difficult, because you need a strong unions, and then because workers' rights, protections of workers' rights, and also, to a certain extension, community right as well. I think this is something that we must not neglect. And then lately, with the introduction of technology, even though it's still a matter that, as labor, we think that there must be, robust and further, debates around the introduction of technology, even though it's already been introduced. We think that with the introduction of very managed technology, it is possible, to achieve zero harm. But if you take the example, for instance, of Ghana, which Georgette has mentioned, where the artisanal small-scale mining is quite prominent, in the absence of investment in community engagement, participation, it's very, very difficult to reach zero harm. I think it's something that, together with communities, employers, and trade unions, setting targets is something that should be achieved. But with our history of poor governance in Africa, I'm afraid, it will take a lot more than ratifying conventions and so on and so forth to actually making sure that the zero harm is achieved. So there's a lot of work to do for this continent. And then one last thing I really want to add when it comes to achieving zero harm is the introduction of what we call today contract mining in the formal mining sector. Mining companies, have, I'll say, washed their hands away from all risks, especially when it comes to safety. As we know, mining is a very destructive and hazardous operation anyway, hazardous to the environment, to communities, health. So with the introduction of contract mining, it's actually added to the fear that we have as labor, that it actually complicates the already challenging and existing issues that we have in the mining sector when it comes to adherence to health and safety standards, adherence to the ILO core conventions, when it comes to health and safety and so forth. So there's a long way to go, but it is achievable with targets. It is achievable with a set of regulatory legal frameworks, the introduction of technologies, involvement of communities, the presence of very strong unions, at the workplace.
Penny, at the ILO, you work across many different industries. When it comes to setting targets of zero harm, have you seen achievements or experiences from other sectors that you think that the mining industry could learn from?
Thank you, Assheton. I'm not going to cite a specific industry or sector which I would say have achieved a zero harm, because what we have noted at the ILO is that we are still lagging behind as a region, if not globally, in terms of indicators that are informing us in terms of occupational accidents and diseases. Lagging behind because of weakness in reporting and notification. So as a standard setting agency, we try to capacitate member states to have functional national system for notification and reporting of occupational accidents and diseases, for us to have confidence in those statistics and to be able to say we have really achieved the targets. So where we sit right now, we have quite a majority of countries that are still struggling with those systems, and we are still working in enhancing those systems to be able to say, yes, we are achieving our targets. In short, I would say it's not really conclusive for us to say, since we are not receiving a lot of statistics, it means there are no accidents or diseases. So we have to handle that with caution. Hence, I cannot cite any sector to say absence of statistics from a particular sector is an indication of the absence of harm or accidents. But we take note of the efforts that are happening in many sectors. Thank you.
At every social gathering, conversations are about technology. Social media and the legacy media feature AI, artificial intelligence, all the time, and how it's going to apply to almost every sector, we're told. In the mining industry, technology and labor, there's a little bit of a battle line there. Some mines are now boasting having up to 70% automation, which of course impacts not always positively on labor. So I want to turn now to our panelists and talk a little bit about how technology can affect, hopefully positively, health and safety, occupational health and safety in the mining sector. And perhaps I could turn to you, Georgette. What is your view on how technology can support achieving these zero harm goals that we've been talking about?
I think that technology can potentially and significantly enhance safety. I don't think it's a solution, a total solution, but it could help. Why do I say that? When we speak about technology regarding the mine itself and its workers, it's easy. It's easier to bring your workers on board using technology. But the mines, we have to remember, are not operating in isolation. I think 2022, for example, there was a very bad accident in the western region of Ghana where there was a blast of when a vehicle was transporting materials for blasting, basically almost wiped out a whole town. If technology is going to be used, we have to remember that we are operating in an ecosystem that includes communities where these warning signs that those of us in the industry are very familiar with and might know the consequences. Sometimes the communities are not so much, they do not completely understand some of the consequences. Of course, technology is great. When you go to some of the mining communities in Ghana now, it's exciting to see electronic boards, that would say blasting will happen at this time. Yes, I think those kinds of, and maybe you don't drive around this area because, there might be flying rock. That's the beauty of technology. It used to be blackboards, but now you see these electronic boards in the community. But for me, how do we bring the community on board?
And how about, Georgette, the use of surveillance technology? I've noticed that this has an uptick, and the temptation is certainly there because we have the technology and know-how to use some of these cameras for different purposes from which they're originally intended. Those can be positive or negative. Is that something that we should be considering, and how do we make it a plus, a benefit?
Yes, for the mining community, we should remember that consent even before you mine, that should guide everything that, we are doing. So if we are supposed to roll out any technology, we need to seek the consent of people. You cannot just, do things that people have not consented to. And people would consent if they understand the benefits. At least that's what I believe. If people understand the benefits of any technology that needs to be rolled out. For example, I know that some of the drivers, there are all these triggers that they use, but they are aware when they're driving for long distances or they're at work that will trigger them, make sure that you are awake. So any new technology that needs to come, consent is important, training, because adopting new technologies is not always easy. And there's always that, technology is going to take away jobs. So I think that it's important that we onboard people to new levels of technology and we just don't get rid of people as well. But communities, for me, having access and being onboarded to know exactly what is happening is also very important, Assheton.
Thank you so much. And Penny, as we're on the theme of data and policies, I wonder if I could turn to you and the approach to the ILO. You talked earlier about the availability of data and, of course, artificial intelligence, or we're told that artificial intelligence can be of considerable benefit if it has large amounts of data and it can look at large language models to identify patterns that we might not be able to see so easily as mere humans. Do you think that this can actually help if organizations like the ILO have a broad view of what is happening in health and safety? Can we learn from it if we apply AI? And how can this be, and should we look at technology in policy and the regulations and legislation around health and safety? Wonderful to hear your view on that.
Thank you, Assheton. When it comes to data, of course, there is an anticipation that the artificial intelligence and advanced technology will improve the real-time collection of data and the accuracy of data being collected. It will also then improve our interventions because they will be informed by evidence and research findings. So when it comes to occupational safety and health, though, there are some of the elements that, again, have to be looked into because of the likelihood of the negative impact that may come with them. As much as the real-time monitoring and production of data can benefit the improvement of occupational safety and health, it can also be accompanied by other issues like the mental health issues, the intrusion in terms of privacy. Human beings, they are used to derive their comfort in being assured that their privacy is protected and they know what is going to be happening and what the information is going to be used for. Such kind of thing can also cause anxiety, and they can also lead to accidents and and other unwanted situations in the workplace. So yes, they are going to be positive in terms of contributing to data and improvement of occupational safety and health, but they have to be used with care. What I have to say there is about ethics. The ethical consideration, justice and fairness should always be the departure point of the interventions, especially when it comes to the collection of data, so that they serve both the employer and the worker in a fair manner.
Paule, Ndessomin, everything we hear in the newspapers and social media regarding health and technology, and as a parent is always a concern to me, I think, and my wife, is around the mental health and how technology can affect that if not managed well. Is that something which your organization is beginning to address, for mental health and the interaction with technology?
First, Assheton, if I may say something regarding technology, and then I'll come to that. We as IndustriALL, I mean, coming from labor, we are very hesitant, I would say, yes, about the introduction of technology, even though if technology, for instance, supports or workers in their work, and then erases any potential hazard or risks at the workplace. Yes, as a labor federation, we are for anything that is to enhance workers and improve productivity and so on and so forth. And as Georgette said, mining happens, it's in within an ecosystem. So when we introduce technology, we really have to also make sure that there's thorough understanding, not only from the worker side of things and also for the communities, because in Sub-Saharan Africa, really many mining sites are actually owned by communities. So it's important that they also take, they take part in the discourse when it comes to the introduction of technology. But however, if you take the example, for instance, of some of the deepest mine that exists, in this world, South Africa, for instance, Carltonville, which goes all the way down to like 4.5 or 5 kilometers. Don't know ever how deep they have gone through these days. It's important to note that the deepest you go when you mine, the more at risk workers are when it comes to rock falls of any kind of safety issue that can happen when you do deep mining. So I think these are instances where we think that technology, the introduction of technology, can aid in lessening or reducing harms, can address all the safety issues that we may have when it comes to workers' safety, underground. So I think with that in mind, we really cannot totally cancel out, the introduction of technology, because so far, some of the advances that have been introduced to mining, for instance, proved safety in these mines. And the other issue that I also wanted to address is the opportunity introduction of technology gives to women. And that we won't stop, in a sector where we are pretty much still not absent, but we really are in very low numbers. And some of the issues that are usually brought about is the fact that mining is too dangerous for women, and yet mining is dangerous for men and women alike. And I think it does give it opportunity to level the playing field for women in the sector. Now, when it comes to the question that you have posed regarding mental health and in technology in the mining sector, I won't diverge from what Dr. Thuthula really had said. But I think that, for any technology that is introduced, it has its pros and cons. And I think as people in the sector, whether the labor side, government side, we all have to play our roles in addressing mental health in the mining sector. And I'm sure technology to a certain extent can address some of these issues, but it's also very important that some of the very important stakeholders play their role in addressing mental health in the mining sector.
Munkawa.
She made a very important point there that yes, technology can be introduced for safety. The workers might feel not at ease, but they might also realize that for safety reason is needed. And again, she mentioned the issue of women in technology, which is really an issue which needs a kind of a deliberate act from government, employers, and workers. What I wanted to say is when we are talking about technology for safety and health reasons, it's important that we do not address it in isolation, but to always aim to achieve that synergy between the safety and health and other fundamental principles and the rights at work. We are talking about the rights to collective bargaining and the prevention of forced labor, child labor, and discrimination in employment and occupation, and all those rights. Because when it comes to technology, it's very much easy for the change in the form of employment and the work arrangements to pose challenges to the workers' organizing efforts and negotiation. And that way they are left unable to negotiate for safe and fair working conditions, including the impacts that are coming from technology. It's very much easy for the non-skilled tasks to be pushed to the lower segments of the value chains, where issues of child labor and forced labor can very much easily become prominent. It's very much easy when the technology advances for women to be even more excluded, because traditionally these are work that are male dominated and women are not capacitated when it comes to technology. So what the government's employers and workers really need to do is to strike that synergy between the OSH and the other fundamental principles and rights at work, so that we do not find ourselves with workers unable to organize themselves because the new forms of employment are not allowing them. We do not find ourselves with more tasks pushed to the informality where it's easy for people to find themselves in child labor and forced labor and other kind of things, or to make sure that women still are able to advance careers in mining sector. That have to be really a deliberate action to capacitate women to follow the career in the mining sector. And now one thing I wanted to mention is as we say, we have been having standards that have been protecting or aimed to protect women when it comes to underground mining. So with technology, underground mining is going to be also advanced or made safer and easy. But even without that, the ILO has been moving away already from that form of discrimination, and rather emphasize on the application of other conventions that are not discriminating women from working underground, like Convention 176.
Perfect. We've been talking about health and safety of workers in the mining workplace, but one of the trends I've noticed over the last 30 years is the responsibility that mining companies have taken on or been obliged to take on has extended now beyond the fence line and into the community. So community safety, community health is one of those topics. It's no longer just an add-on, but is cited in regulations, legislation, and industry standards. So the question here then to the panelists is, what extent do you think that mining companies should be responsible for the health and safety of mining communities?
Actually, it's vital. As we said earlier, mining doesn't happen in isolation. It takes place within, a community. It's most likely will, and it definitely affect the livelihood of the people, living around the mining site. Zambia, Madagascar, wherever. I mean, in Africa, I'll just stay in Africa, where mining operations, have affected community livelihoods, a high level of lead, in the water that the community drinks. Some of the communities, for instance, in Madagascar, have completely lost their livelihood. The disappearance of some of the indigenous fish, that they used to consume, With that, we think our mining companies are and should be liable actually for some of the hazard that mining actually creates. We have all the ESGs and then the corporate responsibility, a policy that exists, but they're not, solid, and many often they don't actually adhere to some, strong standards that already exist. I'm quite happy that with the introduction lately of the mandatory due diligence laws in Europe, And hopefully now with the introduction of the EU supply chain directive, which get to make a multinational company responsible for, the supply chains, we are actually hopeful that it's going to change, because in some of these laws, it's actually extends also to communities, to how mining operations of any company's operations, affect the lives, of workers and in the communities alike. So I think this will be a great game changer, even though as a continent, as a mother body on this continent should actually also come up with its mandatory due diligence laws. But in the absence of that, we think that, whatever is available, because the majority of the mining companies are European, American, Canadian, Australian. So I think it's important that when these laws, are implemented, we set to see some changes, when it comes to some of the violations that are brought about from European Court of Law or Justice, for justice to be rendered to community and workers that have been harmed or whose livelihood have been affected with the mining operations.
Thuthula, Balfour on community health and safety.
Thanks, Assheton. I wholly support what Paula has been saying. Mines are sometimes located in communities. And so it is the responsibility of the mine to ensure that it does no harm to the community, that the health of the community is even better than, generally, because the mine usually has more resources. In South Africa, for instance, we have social and labor plans. So when you apply for a mining license, you need to be stating what are you going to be doing for the community. And if the community says a clinic is what they require or a school, then it's part of what the mine must provide. But when it comes to the direct impact on communities, there have to be those risk assessments, which extend into how is the community affected. And therefore, there is then mitigation of any of those risks. No community should be disadvantaged or should suffer harm due to the mine. Maybe another example I can use, which is more of a health one. In South Africa, TB in the mines is an occupational disease. TB is transmissible, and people stay in a community. So even if you have a great program on your mine, you then need to ensure that you are working with the public health authorities and facilities to ensure that there is no transmission of TB generally, even in the community. So a lot of our companies that have advanced programs, if I can put it like that, they going beyond the mine gate. And so when you have a service, even just generally on health, you say, how do I collaborate with, or even on our own, if maybe the public health system cannot do so? How do we extend our services to the community? Because the employees, as I said, stay in the community, and their families are in the community. So the best for the mine is to ensure that its environment is as healthy and as safe as possible. This can extend to even, roads. Road traffic accidents are a major challenge. Just the existence of the mine can contribute to high traffic volumes. And so it is the responsibility of the mine to ensure that the road design next to it is not adding a hazard, and in fact is improving. So the mine should be part of improving the roads, design such that there is no impact which will lead to a higher, accident rate. So most definitely, the mines do have a responsibility to, the communities that they live with. Thanks.
Georgette, when it comes to community and how mine operations can engage effectively, that all starts with consultation. Is enough being done to consult communities, mining communities, on their health and safety risks, the risks to those communities? And is that a way, or how can we better empower communities to take charge and make known what are the potential risks to their health and safety from activities of the mine, and to bring that to the attention of the mine operators? How do we engage communities? What's the practical approach?
I think that continuing from what Dr. Thuthula and Paula have already said, I believe that it is the responsibility of the mine in the very first place. If the mine had not come, communities would not be exposed to some of these hazards. Community mines tend to engage But for me, what I would say is that I think it is not enough. It is not enough just engaging with community heads. Recently, I was at an event where I explained that it seems like we have not caught up with the new kinds of media. And Africa's population is heavily youth-based. And the youth are not necessarily going to those notice boards in the communities that previously people, were going to. So what is the media forms? What are the mediums that these young people are using so that we can engage them? And I think that regulators and the mines should lead this change in how we disseminate information, any information about mining. What kind of data sharing platforms can be created which is friendly to the whole community? If one platform is not working, how do we use multiple platforms so that everybody gets the message? So much applications on phones. How do we engage the youth? How do we develop community engagement applications? How do we do all of this so that people are informed? I think that's one of the key issues. Information about what is there, information about what is being done, information about what is coming. So in all aspects of the mine, we have already established that the community cannot be ignored, but how do we engage them? And we need to engage with all mediums possible and bring along all the stakeholders at every level. Decisions tend to be taken on national levels a lot. Not enough engagement, I believe, is being done on the community levels. And we need to bring the zero harm concept to small-scale mining as well. In my country, small-scale mining contributed close to 40% of our gold output. How can they be ignored?
We've been talking a lot about the actions that businesses and companies can take, and many of which take these actions voluntarily. But of course, mining operates within an enabling environment of regulations and legislation. What do the panelists believe that the lawmakers can do, the standard setters can do now to ensure that health and safety in the workplace is given the priority, which I believe we all think it is due?
Good question, Assheton. We as IndustriALL, of course, the mining is one of our biggest sector, as I mentioned earlier. I would say that, it's going to have to happen when a set of factors will be in place. Some of the most important one would be adherence to the core ILO standards, for instance. In countries where the ILO Conventions 176 on mining and safety, have been ratified, it's going to be really very important. As IndustriALL, we also are a federation that has signed, national agreements with some of the big multinational companies. And unfortunately, so far we only have one mining company, Omicor. We have a global framework agreement, but we have one that have really worked wonderfully in the past with Anglo-American, and in which we have not really managed to duplicate to this day. Even though we have kind of, MOU, for instance, with Anglo-American on safety and health in the mine, we actually have some kind of collaborative or engagement with some other multinational companies, but that they don't go a long way into addressing, some of the core issues when it comes to safety and health in the mining sector. But I'm happy that at least with Anglo-American, with the MOU that is in existence, with the regular engagement with the companies. It's not perfect, but it's something that exists. And then that allows both, labor and then the mining, the multinational, to address some of the issues around health and safety in the mining sector. So I would say that even in countries that have not ratified the ILO Convention 176, the presence of strong trade unions, such as, Australia, for instance, the presence of strong trade unions, at the workplace has aided, in, for instance, reducing or in making sure that companies adhere to safety standards and compliances, and then some mechanisms, are in place in making sure that zero harm if possible, is achieved. My take is that, we do need all these factors, all the stakeholders. We need investment in communities. We really, beside the engagement with communities, and I agree with Georgette, it can't stop there. We have to invest in communities, especially in Sub-Saharan Africa, and especially also when it comes to safety and health. And in government, we have to address issue around governance on the continent. It's very weak. Actually, I think that this is the real and the big issue on the continent. Despite all the laws and all the guidances, the guidelines, and then the policies that exist, with governance, we really cannot achieve all what we set out to achieve. So I think, it's a concoction, or it's a medley of all of these things, strong regulatory framework, strong GFAs, if possible, but GFAs with mandatory due diligence laws that must be adhered to, because the weakness of our global framework agreement, the past global framework agreements with IndustriALL, is the fact that they are documents and then sometimes companies did or do as they please. There's no legal recourse, unfortunately. And then I think this is what IndustriALL as a global federation strive to achieve this day, to make sure that our global framework agreement, have this legal recourse so that any violations can be taken to a court of justice. So I think this is really going to be my take, on this issue.
Georgette, the regulatory frameworks that are in play regulating health and safety in mining, mineral development more generally, do they address sufficiently the issues that we've been discussing on community, women, artisanal mining, for example?
Assheton, thanks for this very important question. Most of the problems, laws and regulations actually exist in a lot of the countries, but the problem we seem to have is enforcement. Especially when it comes to the artisanal and small-scale mining sector. The lack of enforcement is the problem. When it comes to the issue of women, I think the laws are not available to protect women. There are still cases across the continent where women still complain about inadequate sanitary facilities. Maybe then, they are not enough, or they don't have their privacy, or where you find yourself in an open pit, you're a dispatcher in an open pit, but you cannot, there are no laws that really force the mine to put the facilities, sanitary facilities there. And so I think regarding women, those issues need to be addressed to make them safe in the industry. Even apart from that, the employment targets usually does not address the issue of inadequate women in the sector. For example, in Ghana, our mining university is now training, it's almost 50%, I believe, population of students. So we, even in the formal mining sector, the female talent is available, but mines are not obliged to employ them. And so it will be good to see some kind of action or change or reforms that take into consideration women's participation, their health and safety, and even their entry into the sector. So for me, those two are very key.
Perfect. And Penny, the ILO has a very robust and well-respected framework of standards. Can lawmakers in countries ensure that it is enforced more broadly?
Specifically on occupational safety and health, as you might recall, in 2022, the ILO declared the occupational safety and health, or the safe and healthy working environment, as a fundamental principle in the right at work, meaning that it becomes, if I might use the word mandatory, it becomes one of the mandatory instruments or mandatory conditions to be observed by the member states, alongside other rights such as the prevention of child labor, forced labor, discrimination, and so forth. So that puts some of the ILO instruments like Convention 155 and 187 to become conventions that needs to be ratified and applied by member states. So far, we have observed, although there is a gradual increase in the ratifications, but still the number of the ratifications globally, for example, for Convention 155, which is Occupational Safety and Health Convention, stands at 83 member states, and Convention 187, which is a promotional framework for occupational safety and health, which is also a fundamental convention now, stands at 69. This does not necessarily mean that member states are not heading to the provisions in these conventions, but it also reflects on the capacity of the constituents and the member states to align their laws with the provisions of these instruments. Because as you know, the ratification requires the alignment in practice, alignment of the national laws with the international standards. I want to refer to one of the rights that is very much emphasized by the conventions in the occupational safety and health, which is the right for the worker to remove themselves from imminent danger. So this is a right that have to be explicit in the national laws. It can be the OSH law for any other industry. It can be the OSH law in mining sector. It needs to be clear on what the worker is supposed to do should they find themselves in that serious danger. Many a time we observe that laws are a bit vague, or there are no operational instruments or procedures on how the worker is supposed to operationalize these rights, on what is supposed to happen to the employers to make sure that they take prompt act to apply corrective measures to the observed imminent danger. So these are some of the things that can really bring concerns on the trends of application of the international standards when we observe laws that are still weak in terms of enforcing some of these critical provisions, like the right to remove oneself from imminent danger. Yeah, one of the colleagues made reference to the also rate of ratification of Convention 176, which is occupational safety in mines, which also have made provision for the right to remove oneself from imminent danger, which is standing at about 35 member states so far. So I do not want to attach the compliance or the conformity of member states to the ratification trends, because some of the countries or member states have so far aligned their national laws with the provisions of the standards, although they have not yet ratified the conventions. And it becomes not very much easy to follow them up if they have not ratified, comparing to the follow-up that applies to the member state that have ratified a specific convention. But what I can say is that yes, there is a gradual change, though we could do, hence the ILO still really emphasize the capacitation of the constituents on how to apply these conventions and to prepare them towards the ratification and the full domestication of the instruments.
Thuthula, what will the Minerals Council of South Africa be advising its current administration to do to strengthen or continue to enforce health and safety regulations in mining?
I think whenever, you are a regulator, you need to understand that there's what we call a safety culture maturity model. Companies are on a spectrum. Some only react whilst others are proactive and go beyond what is expected. For instance, listening to Georgette, where there is nothing about women. And so companies will do nothing. The ones which are proactive will do something, but the ones which are reactive and only respond to laws will only do something once the regulator puts in place something. So I think that must always be borne in mind. So for me, those laws have to be in place. The basic laws that promote health and safety have to be in place, followed by effective and fair enforcement. That has also been mentioned, because there's no point having all these laws if actually you don't have the staff. You need to capacitate your inspectorate to be able to do its job, but also to do it fairly. And the two other things I would like to add to our regulators is you need to take data-driven decisions. And so it's important to know, and fortunately we do have an inspectorate that produces annual data, which means you can see where are the challenges and which areas still need, adjustment, such that you don't go and enforce maybe on an area, for instance, where there's now no longer a problem. So you have data, which you then use to take data-driven decisions and legislation which is based on that data. And lastly, I would say the regulator needs always to appreciate the value of the tripartite approach. The regulator should not be high-handed and on their own just decide, we want to do the following. There is much more to be gained by utilizing your tripartite structures with employers, organized labor, and the state to ensure that whatever legislation, policies, and actions which are supporting health and safety are supported by all of the stakeholders, because the three stakeholders are far more powerful in ensuring that they promote health and safety than just the regulator. So those would be my suggestions to the regulator.
Thank you. And that concludes today's podcast. I want to thank sincerely our speakers for joining us today. And to our audience, please check out the remaining of our TDI Sustainability series in partnership with the Mining Indaba of our podcast on suits and boots. Until next time, stay safe.